goes. All right, so we're going to do a Bicillin injection using lidocaine, which makes it more pain-free than just the Bicillin on its own. So what I have here is 2% lidocaine, some alcohol wipes. I have my Bicillin and the needle that comes with it. I have a 23 gauge syringe, and I also have a 25 gauge syringe. As far as a 25 gauge, you can use any extra syringe you have. We just have a whole box of 25 gauges, so that's what I'm using. All right, so I have the paper towel down to help make this sterile area, but I'm going to also make sure I leave the needles on top of the plastic so to help prevent any contamination. And my hands are clean. So first thing I do, and I've never done this before while talking, so hopefully I don't forget any steps. Scott will help me make sure I don't miss anything. So got my alcohol swab. I am going to wipe down the lidocaine top really, really, really well. Okay. And I'm going to use, this is basically the extra syringe, 25 gauge for me, to draw out the lidocaine. Just know too, any needle that you use to poke into the lidocaine, you can't use to poke into your body because the needle gets dull and that hurts. So I am pulling the syringe up, and I tend to overdo it a little bit just to be on the safe side. But I pull the plunger back to the 1.5. Poke it into, I'm shaking, the lidocaine, and I push the air out. Oop, and now I'm going to draw back. I'm going to try to get between 1 and 1.5 of the lidocaine. And it takes a couple, like I kind of squirt it back up and then pull it down again just to get the bubbles out and make sure it's just lidocaine in there. Okay. So that's all set. I put the cover back on. Set it down. Okay, so that's ready to go. Now I'm going to open. I'll open this next. Doesn't really matter what order you do it in. I used to do these just on their own with this needle, and it hurts a lot, so I'm glad that I learned how to do it pain-free way. So I've got the top on the needle. Just going to set it down for a second. And you should mix this up literally right before you do the shot too, because you don't want the Bicillin and the lidocaine to mix. You kind of defeat the purpose if you do that. So I'm going to pull the plunger all the way down on that. I'm going to take the needle off, set it on my plastic. I'm going to pop the top on the Bicillin. I haven't missed anything, have I? And I'm going to have to stand up to do this. I'm going to put the needle, see it, in here, and I'm going to do my very best to make sure the Bicillin doesn't touch the sides up here on the top, because it will mix with the lidocaine if you do that, and the lidocaine will hurt a little bit more going in. So you can tell I've done this a lot. And so I'm just kind of doing it slowly, trying to keep the needle in the center. Oops, I touched the side, but it's okay because I'll go up that far anyway. Now if you have, this is a 1.2 being a Bicillin. If you have the 2.4, that's going to be a little bit different because you're going to need a bigger syringe. You're going to need a fatter syringe to put this in, which you can get from the pharmacy. The next size up, what's it called?
5 ml.
So you're going to need a 5 ml syringe. So that way there's enough room for the Bicillin and the lidocaine. But this is 1.2 of a Bicillin. Okay. So I'm all done with that. I'll put the cover on that when I'm done. So, you see, I did pretty good. It's pretty clear. I'm going to take this. Now, like I said, there's only about up to the 1 on this, on the Bicillin needle. And I got 1.5 of this, but I did that on purpose just because I'd rather have more than less. So I'm kind of squirting it. I'm trying to kind of squirt it towards the side a little bit too to take some of the pressure off it hitting the Bicillin directly. And now that I've got a little bit, it doesn't matter so much. And actually, it didn't even overflow. Okay. Now I'm going to take, it's a pretty good one. I'm going to take, put this back, screw this back on. So the 23 gauge, not quite perfect to squirt Bicillin through, but it works pretty well. So I'm going to make sure there's no air. I like to get a big squirt out. So we're not going to do the shot, show the shot, but basically when somebody's giving you the shot, you squirt the Bicillin, you push the Bicillin, do it, you know, relatively slowly because it does, you know, burn a little bit, not too bad. And once the Bicillin, once all the, oh, what's that called? The lidocaine gets squirted in and the Bicillin gets to the base of the needle, stop, wait about 30 seconds to a minute to let the lidocaine work. And then slowly, whoever's giving the shot, push the Bicillin in. Push it in slowly, and about every 3 lines, you are going to want to stop and just kind of wait a sec before you push in slowly the next 3 lines. Stop and wait until you get it all in. It should take about 5 minutes. All right, that's how you do it. Thanks. One last thing before my husband pokes me. You want to do the shot immediately after making it because you got to keep it upright like this to keep it from mixing. So unless you plan on carrying it around upright like this, you're going to want to do the shot immediately. Okay? Thanks.
Awesome. Make sure the needle's 1.5 inches. So 23 by 1.5 inches.
So, yes, if you didn't hear that, 23 by 1.5 inch needle.